Thanks, dear viewers, for joining us on this edition of the Primetime Newscast on Equinoxe Television, live from our headquarters in Cameroon's economic capital, Douala. I am Babla Jonathan. In our top stories in this edition of the news, as the COVID-19 figures continue rising in the Republic of Cameroon, medical experts are decrying the high risk of infection to which persons manipulating COVID-19 corpses are exposed to, and they were speaking after some families complained that they were abandoned with the corpses of their relatives who died of COVID-19. And we'll be talking about this in this edition of the news. We'll also be talking about government's efforts to acquire more space or sites within the framework of the management of the COVID-19 pandemic in the Republic of Cameroon. Stay with us. The COVID-19 figures are skyrocketing in the Republic of Cameroon. The latest figures from the Ministry of Public Health indicate that 84 more confirmed cases of the COVID-19 have been recorded in the country within the last 24 hours. 22 in Yaoundé, 61 in the country's economic capital, Douala, and 1 in the Betwa, and 805 persons have been successfully treated of COVID-19. 19 more were treated yesterday, and in addition to the previous figure, the country now counts 108 persons who have recovered from COVID-19. In the meantime, 58 persons have died of COVID-19, and among the confirmed cases of COVID-19 in Cameroon, 70 are placed on the oxygen, 34 on the respiratory assistance, 27,000 extraction kits, 43,000 treatments, 100,000 masks, 3,000 thermoflashes have been acquired by the government of the Republic of Cameroon, and the government continues in its quest for greater space or facilities to host COVID-19 patients. Some of the sites acquired within the framework of the fight against COVID-19 yet to be ready. Rehabilitation work is still going on in the Oka supermarket at Carrefour Zoué in the nation's political capital, Yaoundé, and during a visit to the site, Health Minister Manauda Malachi said the site will be ready to receive patients in 1 week. And the special COVID-19 center has a capacity of more than 300 beds, including 26 for reanimation. At the Yaoundé Military Stadium, beds and other facilities are already in place. It will host 200 to 400 COVID-19 patients. This information from the Ministry of Public Health as far as the management of COVID-19 is concerned in the Republic of Cameroon. And I told you earlier that we'll talk about the manipulation of corpses of COVID-19 patients by persons who are neither trained nor equipped to do that. And medical experts are decrying the high risk of infection involved or at the doorsteps of persons who are manipulating corpses. They were speaking to us after some families complained that they were abandoned with the corpses of their relatives who died of COVID-19. Innocent.
The handling of corpses of those who died as a result of the COVID-19 virus was normally supposed to be done by medical officials who have been equipped for the exercise. But in recent days in Cameroon, some families have been forced to bury their loved ones who allegedly died as a result of the coronavirus, something a medical expert frowns at.
Il n'est pas normal que des corps qui sont infectés d'une maladie dangereuse.
It is not normal that an infected corpse should be handed to the population. This corpse can cause an epidemic in the village.
Sur lesquelles on peut potentiellement fait des incantations, des rites. Alors vous imaginez un peu ce que ça peut causer dans une communauté.
According to him, corpses of the coronavirus patients are very dangerous to the health of the people around.
Ce sont des corps qui doivent être sous.
Such corpses have to be under strict control. They have to be buried by the administration. Added to that, the casket is to be sealed that no one can't even open it.
Soit impossible de les ouvrir.
A family in Douala recently buried their father, who was suspected to have died as a result of COVID-19, but their corpse was handed back to them for burial by officials of the Gyneco-Obstetric Hospital of Inyasa. We thought of taking him to the West region since he is a notable there, but thinking that he was a corona patient, it will be tough and many others could be infected. So we took him back to the Inyasa Hospital mortuary. The mortuary attendant refused to take care of the corpse.
Je vais donc aux urgences rencontrer le médecin pour que le médecin me fasse un certificat. Donc dans le certificat que le médecin a fait, il n'y a pas de cause de la mort sur le certificat. C'était déjà minuit pour morguer.
We were told to do everything to ensure that we come back to get the corpse the next morning.
On a dit de faire tout ce pour que le matin on ait le cercueil et le lieu du cimetière dans la ville.
West Regional Governor Awafonka Augustine, in a media release recently, has frowned at persons who exhume corpses of alleged corona patients in Douala over the night to come and bury them in Bafoussam.
Smanjik and Gabriel reporting there on the manipulation of COVID-19 corpses by persons who are neither trained nor equipped to do so. President Paul Biya's close to 2 billion francs CFA COVID-19 aid left the nation's political capital Yaoundé today for the 10 regions of Cameroon. The consignment of anti-coronavirus material will be received at the level of the regional headquarters by the governor. The materials will be dispatched to the 360 subdivisions of the country while handing over the presidential aid to the administrative authorities in the nation's political capital Yaoundé. The Minister of Territorial Administration Tanganji Paul insisted or indicated that the head of state has insisted on vulnerable groups of persons. Administrative, religious, traditional authorities have been urged to ensure that the presidential aid gets to the right destination, that is the right persons. Now we talk about the strike action of some health workers in the nation's political capital Yaoundé, notably workers of the National Drug Quality Laboratory, Drug Quality Control and Evaluation Laboratory. 4 months of unpaid salaries is what has sent them to the street. January, the salaries of January, February, March and April have not been paid, and they tried to no avail, according to them, to get solutions from the management of the institution, and so they decided to take to the streets. Now we're taking you to the west region of the country to talk about 3 suspected assassins who have been arrested by forces of law and order in the Nun. It is, of course, in the west region of Cameroon. They are reported to have killed a 4-year-old girl called Raina Usna. Immaculate Fogwe files in details.
Deprived of life by her uncle and his group of assassins in Koutaba, Nun Division, West Region of Cameroon. When her father arrived home, he noticed that his daughter was not at home. It was from there that we started searching for her in the compound. We later called the other kids who were living in the compound. One of them explained to us that she saw her uncle calling for Raina to come and get sweets. So it is from there that we started suspecting him. Some other persons testified that they saw him on the road carrying a big black bag. In their quest to know Raina's exact whereabouts, family members alerted the force of law and order, who immediately launched a search.
Sur dénonciation, la Légion de Gendarmerie.
Immediately as we got the information, the Legion commander dispatched some of his boys to the compound. The information that we gathered on the field helped us to get hold of our first suspect, Kupa Amido. From his declaration, we were able to track down the others. The phenomenon of kidnapping and murder, human bone trafficking, is on the rise in the Nun Division, West region of Cameroon. The population are called upon to collaborate with the force of law and order to eradicate the evil practice.
And some 8,766 state personnel have been summoned by the Minister of Public Service and Administrative Reform to justify their continuous absence at their duty post before they will be sanctioned, and they have been suspended from the state payroll. Innocent as a fires in details.
166 officials of the public service asked to explain themselves before possible sanctions. They have been suspended from pay since the end of 2019 following a series of decisions of the Minister of Public Service and Administrative Reform, Minfopra, Joseph Lay, noting their irregular absences at their various workstations. Amongst them are 3,721 state agents covered by the Labour Code and 5,045 civil servants. Out of the 3,721 state agents invited to give explanations justifying their absences are over 300 teachers. Due to the COVID-19 pandemic and social distancing rule, the identified public officials are expected to file their justifications by email or WhatsApp. Otherwise, they will be liable to the disciplinary sanctions provided for by the regulations in force. Trained 80 staff from the Ministry of Public Service and Administrative Reform and the Ministry of Finance, according to the Secretary General of Minfopra, have been specified the stages of the disciplinary procedure which the public agents concerned will face. After signing the written request for explanations and the responses given by interested parties, the procedure will continue its course with regard to state agents covered by Labour Code, either by a restart of salary payment, a warning, a reprimand, a grade reduction, a change in category or dismissal. For that which concerns civil servants, the said procedure will result in restart of payment if the justification is satisfactory or by a translation before the Permanent Disciplinary Board of the Public Service should doubts persist.
Talking Point is up next. Thanks, ladies and gentlemen, for joining us in Talking Points. Our guest is joining us from the United Kingdom. Dr. Montio Kaba Morgan is an expert in otorhinolaryngology, in other words, an ear, nose, and throat specialist working at the Basildon Hospital in Essex, South East of England. She's the chairperson of the Association of Cameroonian Doctors in the UK. Dr. Montio, you're welcome.
Thank you very much, and I commend your effort saying otorhinolaryngology. It's not very many people who can say that.
Thank you for joining us, Doctor. Now, we want to first of all share your experience, your COVID-19 recovery experience. Have you been able to establish how you got infected with COVID-19?
Yes. I work as an ENT surgeon, as you quite rightly said, and this all came about having been exposed to a patient who had COVID-19. That patient was not symptomatic, so that's a very important thing to know, that sometimes patients may not, or people may not be symptomatic. but are carriers of the virus and can transmit the virus, which is why it is very, very important to follow the guidelines that the Ministry of Health is putting out, that we all know: prevention, 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 washing hands, coughing into your elbow, not going close to people, not shaking hands, you know, maintaining the social distancing, and all of the things that the Ministry of Health is telling us to follow.
Right. How did your body react? How were you feeling when you contracted COVID-19?
The first thing is that I came down with a cough, and I had a dry, persistent cough, and a headache like you've never had before. And then I developed a temperature and body pain. Subsequently, my temperature went up over the next few days with a lot of body pains, the kind of thing that you would describe in Cameroon as j'ai le palud. You know, when people say j'ai le palud, my body's aching all over. And then I lost my sense of smell and taste for a couple of days. All of these went on up and down for about 7 to 10 days before I started feeling better.
All right, let's talk about your treatment. How did it unfold? How were you treated by the medical experts there in the United Kingdom?
Right. So this is where things are a little bit different in Cameroon, around the world. So as we know, and I will never get tired of saying it, prevention is better than cure. There is no known treatment that everybody understands for this virus, and so prevention, prevention, prevention. But supportive measures such as taking vitamin C. I took vitamin C 2 grams a day because knew that it was something that I would have to be exposed to sooner or later. People cannot actually get vitamin C. There are very, very good alternatives, fruits and veg, which are high in vitamin C. And I just recently read an article by Professor Julius Oben, who was talking about all the different, nutritional supplements that you can get from food. You know, so it's not necessary that you have to go and get vitamin C or zinc from the pharmacy. You can get it in the food that you eat. Egusi, for example, is very, very high in zinc. So those are the sort of things that people can do. For me, I took vitamin C. I took a lot of paracetamol, 4 grams a day when I had a temperature. I also did some just a nasal steam inhalation, not the full steam bath, but nasal steam inhalation with menthol and eucalyptus, and a lot of chest exercises, respiratory exercises, because I normally do yoga, breathing exercises. So that was good to expand my lungs, and I found that helped. The other thing was, because I was self-isolating, I was alone at home, and I had to remember to get up and get some food. My family and friends came to the door and brought food for me. So a strong mental attitude, because I had to get up. You might have seen some videos that Camdocs UK have put out, media and support for colleagues in Cameroon to give people ideas on how to prevent the illness and so on. So when when the temperature goes down, I'll get into the shower, have a shower, and then come and sit downstairs and do a video and join with my colleagues among Camdocs UK. So although I was physically alone, I was not mentally alone. I had a lot of support, and that is very important.
All right. Other frontliners like you, as far as the fight against COVID-19 is concerned, are following at the battlefront. We remember the doctor in Italy who died, and at least 2 or 3 of them who have died of COVID-19 in the Republic of Cameroon. When you contracted coronavirus, were you afraid to die?
Well, that is a very good question. Thankfully, I was among the 80% of people who would get a mild to moderate dose. I never had to be admitted to hospital. So death is part of life, you know. So in a philosophical way, one should be always prepared to die. I'm a doctor, I see death all the time. But in this case, I would say, if you get coronavirus as a general person, if you've had a low dose of coronavirus from somebody who has the disease, it's not something to be panicked about. Most people will have a minor or a moderate dose of the disease. They will get better. They should, you know, do the social distancing, confine themselves away from the rest of their family. If you're in a house with other people, stay in your room, open the windows and so on. So panic and fear is not a good thing to have when you're in this sort of situation. So a positive mental attitude is probably better to have than to be afraid to die.
Right, I was asking that question because I know that I'm not a medical expert, but I understand that the state of mind of a patient has an impact on the manner in which the body will respond to treatment. And there is always the tendency of getting into fear and, you know, panic, even when it's just normal cold and nothing that has to do with COVID-19. So what advice would you give to persons who find themselves in this situation, either having some symptoms or having the COVID-19?
Very important question, and an absolutely beautiful question. The thing is to be very, very sure about where you get your information. So there are so many different stories awash on social network and social media, but the fact is this: coronavirus kills much less people across Africa than malaria does. So coronavirus is a problem. However, if you keep it in context and know that 80%, like myself, of people will have a mild to moderate illness and get better, and also remember that you can support yourself by doing your body, boost your immunity, do your exercises, take lots of fluid, follow the good example. CamDoc UK has a lot of educational material out there. Follow us on YouTube, follow us on Twitter, Instagram, and go on our webpage. You'll find that people who have proper advice will give you more. So many people have died. If you have COVID-19, if you get koro, you're dead. Am I dead?
You're not dead, of course. And doctor, how long did it take for you to completely recover from the infection?
So I was exposed to the patient on a Monday. That's about 4 weeks ago. I started having symptoms on the Thursday. On Friday, I stopped going to work. Over the next week, I really had the high temperature, the cough, and the body aches and the tiredness, the real tiredness. And possibly about 10 days, I was feeling better. The cough lasted for about 3 weeks. In the 3rd week of my illness, I was back to work. I was back to my to doing consultations from home, and then in the 4th week, then I was able to go back to work. I must say, testing, even in England, ce n'est pas donné. Testing, even in England, ce n'est pas donné. So I was tested 3 weeks after I fell ill, and I was positive.
When you say testing, even in England, ce n'est pas donné. What do you mean by that, doctor?
What I mean is that across the globe, there is a shortage of test material and testing kits. So the UK government was a little bit behind in provision of testing. So people who were on the front line, real front line, like A&E, accident and emergency doctors and medical personnel, they were prioritized for having the tests. So somebody like myself, because I was already I was already isolating at home, then I was not in the front line as such. So I was not tested until 3 weeks after I fell ill.
How much of protection do frontliners like you, medical personnel, working in this difficult context of a global health crisis, have those of you in the UK?
This again is a very controversial subject because this, and we all know this virus came from China and it spread across the globe by people traveling, okay? And I suppose that there were different approaches, and we know about the WHO guidance, we know about the different strategies that different countries have taken of mitigation, of suppression, trace testing, and pharma prevention, you know? So within the UK, the actual starting of providing preventative personal protection equipment for medical staff was a little bit slow, but now we're getting to the point where we're able to get more of it. But across the globe, there has been a great shortage because it comes from China, and we all have to go and buy it from China. Right now, we in Camdoc UK have a massive drive, along with other colleagues of ours who are in Cameroon doctor diaspora associations in Europe, such as AMCI in Italy, Medcam Bell in Belgium, Medcam France, Swiss MD 237, and Campomedics in Germany, as well as Camdoc UK. We are on a fundraising drive to provide personal protection equipment as a supplement. I heard a lot earlier on in your program the wonderful, the wonderful initiative of the President of the Republic, who has sent out all this equipment to the 10 provinces. So as a supplement for our colleagues who are working in Cameroon who do not have this PPE, we're raising funds to be able to get this across to them. And we are hoping that we will be able to protect them because, again, we're back to the thing of prevention, prevention, prevention.
The President of the Republic of Cameroon, Paul Biya, has disbursed close to 2 billion francs CFA besides the 1 billion francs CFA in the emergency fund to purchase these equipments that have been dispatched to the 360 subdivisions of the Republic of Cameroon. Yesterday, the British Prime Minister Boris Johnson said the UK was recording some remarkable achievements or success in the fight against COVID-19. What's the situation where you are in Essex, in the southeast of England?
In Essex, in my hospital, we have started to plateau. It has been, we've got, today in my hospital, we have 200 odd patients who are being treated for COVID-19. We have possibly about 30 of those on intensive care beds. But it is starting to slow down. We have seen, unfortunately, quite a lot of deaths in the grand scheme of things. One of the medical, the nursing care assistants who works in our hospital, unfortunately passed away last Thursday from COVID-19. And today, at 11 o'clock across the UK, we had a minute of silence to recognize and have a pause to think of those of our colleagues within the healthcare system who have lost their lives. One of the first to die within the medical field was a colleague of mine, an ENT surgeon who was originally from Sudan, Dr. Amjad Al-Harani. And here I also understand, and I know that one of the first medical doctors to lose their lives in Cameroon was Dr. Chwamo in Douala, who is also a colleague ENT surgeon like myself. Here in England, we have had a few Cameroonian deaths from COVID-19, which has really devastated our community. And in the light of this, all across the Cameroonian communities in England, I am very pleased to say that people have been so generous in CamDoc UK's appeal to support us to provide PPE for our healthcare personnel in Cameroon.
In the United States, many of the dead victims of COVID-19 are blacks. Is it the same situation in England or in the United Kingdom as a whole?
Yes, indeed it is. And we have actually written to NHS England, and there has been an inquiry group set up. I also sit on the board of the General Medical Council Black and Minority Ethnic Inclusion and Diversity Group. And we have started looking into why it is that a lot of the healthcare workers who have died in the UK have been from the Black and Minority Ethnic Group. There are many, many proposals about this, either because, first of all, there are a lot of us who work within the NHS. So, and a lot of us work in the front lines. A lot of us also work in jobs where we could be more exposed. So these are all things that have been proposed as reasons, possible reasons. But until we have a full investigation into why this is the case, we're not yet sure. But yes, there is that trend. I actually saw on my news feed today that there is a hospital in England, in the south of England, which has put Black and minority ethnic staff as those being on the protected list. So they are prioritized to get the equipment just because of this trend.
All right, Dr. Montiu Kaba Morgan, let's come back home to talk about COVID-19 in Cameroon. The figures are still rising. What's your analysis of the situation of Cameroon?
It really, really strikes dread into my heart when I look at what happened here in England, what happened in Italy, for example, with the figures that kept on steadily climbing, and then the trying to flatten the curve. I'm sure you've seen these figures of trying to flatten the curve by applying measures of social distancing, of prevention, of all the things that we've spoken about already. The problem within our context is that we are stuck between the devil and the deep blue sea, so to speak, because in the context of urban overcrowding, how can you apply social distancing to a level where it is meaningful in a house where you have maybe more than 7 or 8 people sharing a few rooms, sharing a few amenities? How can you apply social distancing where you have so many people in the informal sector working, having to go out every day to make a living? And if you now close down all the businesses, how is it possible that these people are going to live? So it's very, very difficult. You know, our context in Cameroon and in Africa, sub-Saharan Africa, and in the Indian subcontinent, and in South America, all of these areas where our socioeconomic states are pretty similar, are very difficult. I don't know the answer.
And there's a problem of medical personnel who are not very well equipped and protected, health facilities that are not well equipped. Many parts of the country lacking health amenities, and this is what is the impact of this on the evolution of the pandemic in the country?
It will be the same as the evolution of the pandemic in any country. COVID has no respect for age, sex, color, political affiliation, nothing. So if we cannot provide personal protective equipment for our healthcare staff, if we cannot have basic hand washing and hand hygiene strategies to prevent the spread of the disease, it's going to be rampant.
Government has been implementing a series of over 20 and more anti-COVID-19 measures for the past weeks, and the figures have continued rising. As an expert, what else should be done to stop the COVID-19 figures from rising in Cameroon?
Education, education, and more education. The thing is, there is a lot of information and a lot of misinformation out there. So people need to take this seriously. It is serious. So you can't just say, oh, I have a mask, but I wear my mask around my chin. You have to wear your mask properly. You have to wash your hands. You have to socially distance yourself. Don't go out just to hang out with your friends just because you feel that, oh, I'm going to take whatever it is, the latest thing, bitter cola, or you're going to have your steam bath like some celebrities have been doing, and then you'll be okay. So taking this seriously is very important. Prevention is the only way to flatten that curve and stop the infection from spreading. We don't have the equipment to put people on ventilators. We have to, if we get to that point, we've lost the battle. We've lost the battle.
All right, government has been carrying out sensitization, and other persons are talking about community efforts within communities to educate the population. What do you think about this?
I think that they're fantastic. I think that they're very commendable. I've heard about quite a lot of them within the different communities. Hand washing, you've seen some really, really, really innovative hand washing structures that have been set up hand gels which have been handed out. We are working and supporting NGOs such as Ascovim and other NGOs who are handing out masks to the community, to the communities. We know that there are people who have been making masks among the communities to hand out to people. Those are all very, very, very good, and I suppose, well, not I suppose, I know that they are all supported very, very firmly by the Minister of Finance, the Minister of Education, the Minister of Health, I mean, my colleague, the Minister of Health, Malakai Manauda, and these are all things which are very commendable.
All right. After Madagascar, where the president declared that we have found the cure of COVID-19, traditional medicine for COVID-19, the Archbishop of the Douala Metropolitan Archdiocese of the Roman Catholic Church, who is the president of the National Episcopal Conference, His Grace Samuel Kleda, said he found some herbs which he mixed and administered to some COVID-19 patients, and they recovered. What do you think? What's your take on African traditional medicine as far as COVID-19 and other health problems are concerned?
Well, that's a fantastic question. I'm not exactly sure what herbs they are that our clergyman has found. But as we know, going back to history, a lot of well-known medications have come from plant and medicinal plants. We can talk about digitalis, which came from the foxglove. We can talk about quinine, which came from the bark of a tree. So it may be possible that some of the herbs have some sort of medicinal properties. I'm not sure, but as a medical doctor, as a scientific person, I will suggest that we have possibilities to study these herbs and see what is in them before we say that they are a blanket cure.
Is African or can African traditional medicine be considered as a possible way out of COVID-19?
I think, as we alluded to earlier, the mental state of a patient is very, very important. And so supporting somebody one way or the other, improving their mental state, making them more positive is a good thing. Now, in association with tried and tested treatments, tried and tested as methods, public health methods that we know have to be the way forward. Prevention, prevention, prevention. Don't go out to a cry-die and go and go and just expose yourself to COVID-19 because you know you're going to come back and have the concoction that the bishop has got. If you do, unfortunately, fall to COVID-19 and you are able to get something which makes you feel better, you know, there is such a thing as a placebo. I'm not saying that the bishop's medication is a placebo, but as long as it helps somebody, it's better. But I would say that the way forward is to prevent yourself from getting into this position before you start looking for a cure.
The Association of Cameroonian Medical Doctors in the United Kingdom has launched fundraising for COVID-19. What's the purpose of that?
I'm glad you spoke about that. The Association of Cameroon Doctors in the UK have been doing a lot of fundraising even before COVID-19. We raised funds and we got some books and went and shipped them to the University of Boya. We have sent doctors who went to give lectures at universities. We have an MOU with the University of Chan, which I recently signed at the last time that I personally joined a medical mission with the Mike and Mauricia Pacha Foundation. So CamDoc UK raised funds for a lot of things. In this particular case, we are raising funds hopefully to be able to supplement the personal protective equipment that the government is providing for our colleagues, the healthcare personnel in Cameroon, as well as face masks for the population to prevent them spreading the germs by droplets and spray method, aerosol generating methods.
Some politicians have undertaken a similar initiative in Cameroon, and the Minister of Territorial Administration said, "Stop, this is illegal. You have not obtained authorization from me, and so you cannot go on with fundraising, no matter the purpose for which you want to raise the funds." What do you think about this attitude of government?
I'm not a politician, and so I can't really say anything about the Minister of Territorial Administration and the government on this. On CamDoc UK, I can certainly say that we are a charity registered in the UK, and we are accountable to the Charity Commission here in the UK for raising funds for the purpose that we have. And as you well know, this purpose has not always only been for COVID-19. CamDoc UK has been a charity for the past 10 years. We've been in existence for about 12 years. So I would prefer not to, I really don't know about what the Minister of Territorial Administration's idea was. Maybe he wanted rather to discuss with the people who were fundraising to have a more concerted approach to doing things. But from CamDoc UK, as I said, we're a UK charity, and we are regulated by the United Kingdom Charity Commission.
Dr. Monsieur, do you have a last word before we go?
Oh, I would love to say thank you very much for having me on your on your show. I have really enjoyed being with you here this evening, and I hope that your audience has probably picked up a few little things. I would like to encourage them to go on to CamDoc UK website and follow us on YouTube. We have a lot of educational material, and we will be putting out some more. I would also like to throw out a challenge to Équinoxe TV to come back and invite us some more. We have quite a lot of experts on CamDoc UK. Our current vice president is an infectious diseases consultant. Unfortunately, because of where he lives right now, he cannot join you on Skype, but possibly he can give you some tips or some help. We have quite a lot of other specialists within CamDoc UK who would be delighted to come and talk to your audience.
We too will be delighted to receive them on Equinoxe Television. Dr. Monsieur Kaba Morgan, expert in otorhinolaryngology, that is, in other words, ear, nose, and throat specialist, working with the Basildon Hospital in Essex, southeast of England, chairperson of the Association of Cameroonian Doctors in the United Kingdom. Thanks for joining us today.
Thank you. Can I say one last thing?
Go ahead, please.
I was just going to say thank you very much also, because we are supported by the ONMC. We are a branch of the ONMC, the Cameroon Medical Council. And another thing would be wonderful when we do bring our PPE for our colleagues, if Equinoxe TV could be there to cover it. That would be wonderful.
All right, thank you. Thank you. Thank you for being with us, Doctor.
Thank you.
Thanks, ladies and gentlemen, for staying with us in this edition of the Primetime Newscast on Equinoxe Television. Goodbye.